Due to lack of awareness and extreme poverty, Noma, a disease that attacks facial tissues and bones among people in rural areas, mostly children between the ages of 2 and 6, continue to spread rapidly in the country. In recent years, Nigeria has sought to increase awareness of Noma and scale up its response activities as part of commitment to eliminating the debilitating disease by developing and implementing a national action plan for the Noma prevention and control in collaboration with WHO and other partners. The Minister of Health, Dr. Ohaniri Osage, has said that the provision of the Craniofacial Center at the National Hospital Abuja has introduced a free medical service for Noma patients.
But it is not contagious. And what it does is that it rapidly eats away the soft tissue, but even the hard tissue, the bone, beginning from around the mouth, and ultimately begins to eat away tissues of the face. And if it is untreated, it results in the creation of a very bizarre disfigurement of the head and the face. This disease progresses rapidly, and if it is not properly treated, it can become worse and worse and threaten the life of the patient. It has a fatality of up to 90%, which means that 9 out of 10 people who suffer from this Noma can lose their lives. And the most vulnerable ages are the ones at 2 years and 6 years. And generally we know that people who suffer from Noma also suffer from severe malnutrition. They are from very poor homes, and because of very imbalanced diet, they have poor and weakened immune response. The diet is also not balanced, so they do not have enough vitamin and immune system that is very weak. Now, of the 10% who survive, they can have very severe facial disfigurement, as has been described, and they can have difficulty in eating, in swallowing, in speaking, and in their communities they can face mockery and discrimination.
He also called for collaboration with other agencies to integrate oral health into their programs while receiving continued support from National Orientation Agency in raising awareness for this disease.
The Federal Ministry of Health is pursuing a number of activities to raise awareness on this disease, and we're also training various categories of healthcare workers on early identification, treatment, and appropriate referrals of cases of Noma for expert treatment. There's been a positive response from these trainings, as evidenced in the increasing number of cases that are now being reported from hospitals. Unlike previously, when sufferers of Noma knew not where to seek treatment. Now more and more people are seeking treatment. There's also a paradigm shift in the increasing attention given to oral health in terms of budgetary allocation. I think the Director of Health Services can tell the hospital services can bear evidence of that. And the delivery of effective oral health care, which is now being taken more seriously. And to this end, the Ministry of Health is collaborating with other agencies, especially the National Primary Healthcare Development Agency, to integrate oral health into their program, into the basic oral care program of the primary healthcare delivery services. And we are also collaborating with the National Orientation Agency to ensure that appropriate messages are disseminated at the grassroots level.
The Permanent Secretary, Ministry of Health, Mashi Abdullahi, who was represented by Dr. Alex Oko, says the provision of good nutrition will aid the prevention and eradication of this disease, while charging the need for continued advocacy.
It is pertinent to note that the advocacy for prevention and eradication of Noma has become necessary due to lack of awareness and prevalent harsh socio-economic conditions, which have further increased the incidence of this disease that is largely preventable with provision of good nutrition, personal and environmental hygiene, while early detection mitigates its severity.
The Director General, National Orientation Agency, Dr. Galba Abari, who was represented by his Deputy Director, Public Enlightenment and Mass Mobilization, Mrs. Teresa Madukwe, emphasized the need for good nutrition and personal hygiene during the period of sensitization.
This Noma disease is indeed a topical issue. Noma disease is a disease that does not allow your identity to be normal again. Even after surgeries must have done, it can never be like the original. It gives you something that is, you can carry on with. For that reason, National Nutrition Agency stands with you that normal disease shouldn't be in our midst. As it is called the face of poverty, it is also as a result of poor everything, poor hygiene in our environment, poor personal hygiene, and also poor nutrition.
The president of National Dental Association, Dr. Tope Adeyemi, called for adequate oral health manpower to eradicate normal disease in rural areas in Nigeria.
The Nigerian Dental Association is of the opinion that Noma is underreported in Nigeria, as areas where this disease is prevalent have security challenges which impede access to healthcare and field research. The NDA and her members have been playing various vital roles to eradicate Noma, which include, but not limited to, community mobilization, prevention, diagnosis, and treatment of Noma and its complications. And just recently in September, we lent our voice at the World Dental Parliament in Geneva, Switzerland, to support the FDI's advocacy to WHO for the inclusion of Noma as a neglected tropical disease.
Noma Omeje.